CT scan, computerized tomography. It can be thought of a complex form of X-ray, so consists of high-frequency energy from the electromagnetic field. How it works: fan-shaped X-ray beams, collinear detectors, and attenuation coefficient. Components: gantry. A gantry which has an X-ray beam rotating around the patient, generating X-ray. Stationary collinear detectors. These detect those X-rays. Couch. Patient lies on it. Control room has a computer and a monitor to display images. Each time gantry rotates, it sends out X-ray and are absorbed, reflected, or transmitted depending on the body tissue involved. This is known as attenuation. Each time tissue, there is different attenuation called attenuation coefficient. For example, water is 0, bone is 1000 Hounsfield's. Air is minus 1000. Process. X-ray passes through the body tissue, detected by stationary collinear detectors. Each time gantry rotates, generate the axial slide, which is made of number of pixels, and they corresponds to the volume of tissue called voxel. Radiologists can manipulate the attenuation coefficient depending on the window of the tissue he want to see, like a bone window, soft tissue window. Advantages: good for complex anatomy, 3D reconstruction, complex fractures, evidence of union, and complex bony deformity. Disadvantages: not good for soft tissue, ionizing radiation, not allowed in women in childbearing age or pregnant. Advances: helical spiral CT. In this, there is a continuous rotation of gantry and multiple slices at the same time. Multi-detector CT. There is a single rotating gantry, but there are multiple detectors, so multiple sections at one time. PET-CT, positive emission tomograph, is a form of radionuclide scanning. Biochemical or metabolic activity can be overlaid over the CT scan, known as co-registered image. Contrast: barium can be given oral, iodinated can be given IV, iodinated plus FDG, fluorodeoxyglucose is possible to be given.